the situation is concerning. It's concerning for our communities that we have this many patients, this many people that are ill with COVID-19 and need to be hospitalized. The numbers are increasing daily. And in fact, for Mayo Clinic, what we have seen that the number of tests that we are needing to supply to our communities because of symptoms, etc., is up to over 30,000 a week. And to put that into perspective, that was last week. 30,671 tests were needed last week for our community. Prior to that, it was around 23,000. And throughout the summer, it was more like 13,000, 14,000 a week. And this just shows how our communities are seeing the spread of this COVID-19 virus. We are in a very different place than we were in the spring. We know how to be safe. We are safe in our facilities. We also know how to treat COVID-19 patients. We have really robust modeling that allows us to prepare in advance for what we see coming down the road as far as COVID surges, and based on activities in our surrounding communities, even further what's going on nationally. And we also model looking at what we anticipate our staff exposure to be and what staffing absences or gaps we may have. The most important things that our communities can do to decrease the spread and dampen the surge is to be safe. That means masking, social distancing, and really robust hand hygiene. The other thing is to avoid risky situations where you can't social distance and you can't mask. This is incredibly important to protect yourself and to protect others, and to get us back to where we want to be, to open things up, to open our world up. We can't do that until we all practice these safe measures. The most critical worry we have right now, as far as our ability to care for patients, is staffing. We have an increase in staff absences, and this may end up limiting our ability to care for patients. But we are mobilizing more staff into the inpatient setting and to care for patients or individuals who have COVID-19 in the outpatient setting. Very, very important. With the community spread as high as it is, we need to make sure that we all stay incredibly safe. Well, first of all, masking and social distancing will help us with influenza also. And we've seen that in the countries in the Southern Hemisphere, that those that were masking really and social distancing because of the COVID-19 virus, we have seen a significantly low incidence of people having influenza. So we're hoping to see that same thing here. I do encourage everybody to get a flu vaccine. That's very important to help decrease influenza, as well as masking and social distancing. But we are setting up testing, and in the near future, we will have testing, simultaneous testing for COVID-19 and influenza based on symptoms.